Hi, good morning. We're sitting here with Dr. Keith Myers. How are you today?
Morning, Talia. Doing well.
Wonderful. So Dr. Keith Myers serves as our Dean of Clinical Affairs here at Richmont Graduate University, and you're also an Associate Professor. We're so happy to have you. Thank you for being the feature of our first Faculty Spotlight.
Thank you for having me.
You're welcome. So let's get into it. So I understand you've served on the Executive Board of Directors for the Military and Government Counseling Association, which is a division of the American Counseling Association. Why are you passionate about counseling or mental health therapy for our military veterans?
Well, it's been an interesting journey, one that was kind of unexpected. I really didn't find my professional identity until 10 years in the field. So I tell students and I tell clinicians, if you haven't found it yet, hang in there. So it's been a little unexpected. I landed a job with the Shepherd Center here in town, which is a catastrophic care rehab hospital for spinal cord and brain injury patients. They have a special program, this residential program for military who have served and have acquired a brain injury as a result of that service.
Okay, wow.
So I really kind of resonated professionally several years ago when I started working at the Shepherd Center, and I realized that, wow, working with this population is really resonating with me on a personal level. And then it dawned on me that, growing up in a family of veterans with my dad serving in World War II and my brother serving in various branches, that this really was kind of the culmination of my personal and professional identities and merging together. So it's been a neat process.
Wow, it's been a wonderful journey, as you mentioned, and great to find your passion in that way. Yeah. So I also understand that you've been published recently as well. And again, I think I mentioned this to you off camera. Richmont, we're very proud of you. Congratulations. Tell us more about your book and how that resonates as well.
Yes, thank you. I'm excited about my book, my first book, and it's called Counseling Veterans, A Practical Guide. And it is published by Cognell Academic Press. Really, this book was intended for two audiences. One audience being the graduate student who is in the mental health profession, so social work counseling, marriage and family therapy, for example, who really want to work with the population. And then the second audience is clinicians who have never worked with the population but really want an introduction into some common issues. And so this book provides that. And so I'm proud of a couple of features of the book. The first one is what I call Veteran Voices, which are interviews by me with actual veterans as we discuss the chapter's topic. It really makes the content come alive. And then the second feature is what we call Counseling Sessions at a Glance, which includes a case vignette and a peek into what a counseling session might be if you're working with a military client about that topic. So I'm excited.
Wow. It's perfect because it's great for the student, as you mentioned, and it's also, of course, great for a military veteran. So awesome. Well, again, congratulations.
Thank you.
And thank you for being a part of this segment.
Thank you, Nadia.